You can't compare a headache with migraine. Migraine is not just a headache. A migraine attack is much stronger than the ordinary headache, and it is usually accompanied by many different symptoms. Migraine is a severe neurological disease. It sounds very complex, because it is. Migraine can be very different from person to person, and it can be even different from each migraine attack, even with the same person. And for example, if I was growing up with migraine as a child, my migraine could look very differently to the migraine that I as a patient am experiencing during puberty and later even during adulthood. So migraine can take many shapes and forms. A migraine attack can last between hours to days, and usually it's a one-sided headache that is moderately to severe in the pain intensity, usually around the temples or the eyes, and it is accompanied by nausea. Even though the migraine attack may be very different from person to person, there are many symptoms that are more common for migraine. For one is the headache pain that I already described, but also nausea or vomiting, sensitivity to light, to noise, or even to smell. And for some people who are experiencing a migraine, there is the symptom of the aura. An aura is a sensation of light, so you can see flashes, you can see different colors and shapes of light, you can have a blurry or wavy vision. And this aura usually appears 5 to 60 minutes before the migraine attack, or sometimes for some people also during the migraine attack. The migraine attack can be divided into 3, depending if you are experiencing aura or not, and if you do, into 4 phases of the migraine stages. The very first stage of the migraine phases is the prodrome phase, and this can last between some hours and up to days. And during the prodrome phase, people with migraine usually they feel irritated, a little bit moody. People around them, their friends, family or co-workers, they might think that they are a little bit depressed during those times, or they are craving food or not having any appetite. And it is a phase where that is also called the pre-warning or pre-headache phase. So this is actually the perfect moment to intervene the migraine attack early. So you might consider taking the medication or your interventions that are non-pharmacological. So for example, you could do relaxation techniques, you could do mindfulness exercises or meditations. For some people, other interventions are already sufficient or helping. For example, having a walk in fresh air. If you find sleep during the prodrome phase, sleeping it off can also help a lot to soften the impact of the migraine, or maybe even preventing it. The prodrome phase is then followed by the second stage for 1 in 3 people at least. We already mentioned it, it's the aura. And during the aura stage, I already said that there's a blurry vision, then disturbed speech might occur. And this lasts between 5 to 60 minutes and will then lead into the third stage that is better known in the general public as the headache phase. What I already said with the often occurring symptoms such as headache on the one side, nausea, but also vomiting can occur. And this is lasting between about 3-4 hours and up to a couple of days, up to 4 days for adults and up to 2 days for young people such as children. And then this full-blown migraine attack is gradually moving into the fourth stage of the migraine phases, and then it's called the prodrome phase. It's about 8 and 10 people living with migraine who are experiencing the prodrome phase. They are experiencing it as a comparison of a hangover. So many people are actually referring to it as the migraine hangover, where they still feel irritated, sometimes depressed, but often also euphoric, and where they are still have to sleep off some of this exhaustion of the migraine, and where they still have to recover. For some people it's even as severe as the headache phase because of this emotional disturbances. So why is knowing the different phases and shapes and forms of migraine now useful for you? You can be kind to yourself in being understanding and saying, well, this is very complex, this is tough and very severe. It's not something that is a quick fix, so I don't need to be very hard on me if this is not resolved within even sometimes just a matter of weeks or months or years. It is a lifelong chronic disease that is accompanying many people during their whole life, or at least until the ages of 50, 60. And we can recognize that this is really tough. So we can be kind to ourselves and we can be kind to others who are experiencing migraine. On the other hand, because the complexity can be very overwhelming and this might lead to paralysis, it is important to recognize and understand what type of migraine am I experiencing, how are the phases for my own individual experience, and then I understand what kind of treatment options there are and at what time I can intervene with what type of treatment or preventative options. So understanding the complexity and the different stages of migraine is necessary to actually moving on from a diagnosis to a treatment to hopefully increased quality of life.